Give me liberty and give me Annette.
Hello, welcome to Annette on Life, Liberty, and Happiness, a podcast where I talk about the Constitution, politics, history, the culture, pretty much anything else I want to talk about. And you can find this podcast on AnnetteTalks.com, iTunes, Stitcher, Spotify, hopefully iHeartRadio by now. They seem to take forever for some reason. And YouTube. And not only is it on audio on YouTube, but also the video. So if you want to see what I look like, or when I have guests on, go check me out. YouTube/Annette Talks. And I always welcome comments, ideas for topics, etc., etc. You can always find me on Facebook at Annette Talks. Talk to me there. Talk to me on AnnetteTalks.com. Send me an email at AnnetteTalks.com. Anyway, so today I've been looking forward to doing this episode for a while because right now we are in the midst of the primary season, and Bernie Sanders has been doing really well, although that's changing now. It looks like everyone's circling the wagons around Biden. But Sanders has been beating the drum for quite some time for Medicare for all. And I haven't really taken this seriously because I've just been thinking, most Americans don't want this. This is silly. I don't need to worry about this. But it seems to be picking up steam as far as being popular. So I have gone out and started doing a lot of research. I've found a gazillion articles. And then I finally actually found a book that draws on all of those articles and then some. It's this book called False Premise, The Disastrous Reality of Medicare for All by Sally Pipes. And she is president, CEO, and Thomas W. Smith Fellow in Healthcare Policy at the Pacific Research Institute. And I really like this book and a lot of her other articles. I also had another book from her, just happened to have it in my closet, which is what got me thinking about it. This is an old one, The Top 10 Myths of American Healthcare, and I read this one a few years ago, but this False Promise is more up to date and right on point as far as Medicare for all. So first of all, I was wrong about this not being that popular. The book, she says, 51% of Americans favored single-payer healthcare in 2019 compared to 40% in 2000. 72% of Democrats want Medicare for all. And Sanders' legislation for Medicare for all got more than a dozen co-sponsors in 2017 and 2019, where he didn't pick up any co-sponsors in 2009, 2011, 2013. So obviously, it's starting to become more popular, which is very surprising to me, because I didn't think that we were the kind of country that wanted this kind of thing. But it seems like what's going on is there's a lot of dissatisfaction with the status quo. And it says in 2019, 7 out of 10 Americans believed that American healthcare was in a state of crisis or had major problems, and has been pretty bad since 1994. So, my own experience with healthcare has been mostly positive. I've always been on employer plans, or when Obamacare came out and I fell through the cracks, I ended up on Medicaid, which is not great, but it was either that or, as the book talks about, there's this gap between being able to afford what's being offered on the private market and qualifying for Medicaid. So anyway, my experience has been fairly good in that I got into the Kaiser system, and so I got lucky with that. But this is not what I want. I want to be able to go out and buy my own insurance that doesn't have a huge deductible. And that's what I've seen when I went on Obamacare. I went on healthcare.gov when it first came out. And the plans were ridiculously expensive, first of all. And then the deductible was so high that I literally would have been paying to never use it. I would never be able to use it. And I think you get a subsidy, and that subsidy wasn't going to be enough to cover it. So it was kind of a joke. So anyway, but for the most part, my experience with healthcare has been good. I call a doctor's office and I'm able to get in usually within a few days if it's something important. Or a specialist, I don't think I've ever waited longer than a month. But that's not the case in these single payer countries, which I'll get to. But it's mostly the cost of care and not the quality of care that's the biggest complaint. The cost of care rose from 2008 to 2018 by 22%. And that's 4 percentage points higher than the overall inflation rate. Obviously, that's way too high. So insurance premiums increased 54% between 2009 and 2018 to just over $20,000. Wages have grown more slowly, so healthcare insurance is taking more and more out of our paychecks. So obviously that's a big problem. Obamacare was supposed to lower the cost of care and ensure that no one went without coverage. It didn't do either thing. Average individual market premiums doubled between 2013 and 2017. Obamacare went into effect in 2014, so it had the opposite effect. A lot of us have known for a long time that the goal of Obamacare was just another step towards single payer. Obviously, that's doing the job because if Obamacare comes along, screws things up even worse. Prices are much higher. Insurance premiums are much higher. So what happens? Everyone's totally dissatisfied and says, we want single payer, we want single payer, because what they're hearing or what they're thinking is free health care for everybody. And I need to talk about that because obviously that's living in la la land if you really think that everyone in this country is going to end up with magical free health care and it's going to be great. It's not going to cost anybody anything and you're going to have all the doctor visits you want, all the best care you want. It doesn't exist in this world. Anyway, so another 20 million people gained insurance through Obamacare, but most of them ended up on Medicaid, like myself. You know, I'm not the only one that fell into that little gap. So by 2018, 27.5 million people were uninsured still. So we still have that. And that number has always bothered me because I think, okay, most people either are in a job where they can get health care or they're on Medicare or they're on Medicaid. So where are these 27 million people coming from? And I'll get to that towards the end of my episode because I've always thought that number was wrong. All right, so Obamacare's failure left Sanders with an opening to claim that it was the private market's fault that insurance went up and that only the government can solve the problem. And Medicare for All's advocates point to Canada and the UK as examples of how it should be done. They want government-run single-payer healthcare. So what I want to do is take this step by step. One of the things that you hear lately is that a lot of people on the left, Obama, Ted Kennedy said this, Clinton, now Sanders and Biden are all saying that Medicare or healthcare is a right. That's like this buzz expression. It's a right. Everyone should have it. And the problem with that is that just because you say, well, there are a few problems. First of all, just because you call something a right doesn't magically mean that you can provide that thing. There's going to be now an unlimited supply of healthcare because it's become a right. So you can't just ignore the markets because you've called something a right. Also, in this country, we have something called negative rights. All right, there are positive rights and then there are negative rights. A positive right is saying, I'm going to give you these things. Okay, this is like the old Soviet Union Constitution. You have a right to housing, you have a right to food, you have a right to healthcare. So the government then has a responsibility to provide those things to you because it is now your right. We have never had those kind of positive rights in this country. We have negative rights. These are the things that we say that the government cannot get in the way of. For instance, our Bill of Rights is a charter of negative liberties. You cannot go out and buy free speech. What you can do is set up a government that it's their job to make sure that you have free speech. They do not get in the way of you using your rights to free speech, bearing arms, etc. So we have negative rights. The Declaration of Independence states that everyone is endowed by their creator, not the government, with certain unalienable rights. Among these are life, liberty, and the pursuit of happiness. And to secure these rights, governments are instituted among men. They are put there to make sure that we maintain these rights that we were already born with. That's always been the philosophy here in this country, which is what makes it unique, what makes it special. So negative rights are, like I said, they're found in the Constitution. It's much easier to define and to secure these negative rights. Okay, we have a Bill of Rights that's 10 amendments that goes into them very generally. It's a lot trickier to define positive rights. For example, what does if everyone all of a sudden decided that we are going to be a more Soviet Marxist style government, which is what Bernie Sanders wants, and we said we're going to amend the Constitution and we are now going to add a bunch of positive rights. Or maybe we're just going to ignore the Constitution like a lot of people do, but we're going to have positive rights and healthcare is going to be one of them. What does that mean? Is it just a right to free medical care? Is it a right to quality medical care or efficient health care? Does it mean that you have a right to get in to see a doctor within 10 days, a specialist within 20 days? Do I get to have all the same health care as everybody else? Is my state going to offer the exact same health care as California? I mean, obviously, there are huge, huge issues that go along with a positive right. And it's like, if you wanted to have a right to food, okay, what does that mean? Because if you're going to have a right to healthcare, shouldn't you first have a right to food? Because you can't live without food, right, or water, and you need housing. Shouldn't you have a right to all those things? This is the road that the socialists will take you down. You can't have a decent life if your belly's not full and you don't have a roof over your head. So government should guarantee those things. So what does that mean? If you have a guarantee to a right to food, does that mean a certain number of calories per day? Do they have to be good calories, or can you have, a little government card that lets you go to McDonald's? Or do you have to buy X number of vegetables? If you have a right to housing, what does that mean? You just have a right to, everyone gets a bedroom and a bathroom? Everyone gets to live in the part of town they want to live in? There are obviously huge, huge problems with this. And what are the trade-offs that come with that? In healthcare, we're going to get into this later, but do you think that the government's not going to tell you how you need to live your life? In England, they won't give you the surgery if you're too obese or if you're a smoker. This is the problem. If the government, this is something that I had to explain to my classes when I was teaching political science at ground campuses. When government gets bigger, your liberties get smaller. That's just a fact of life. There's no way to get around that. When you give somebody else power, you lose some of yours. So if we're going to go down that road of private or positive rights, what are you willing to give up as far as your own rights? Are you going to give up your right to choose your doctor, to smoke if you want to be overweight if you want to? Are they going to start telling you that you need to exercise every day? I mean, that's not illogical. If the government is going to be expected to pay for your health care, shouldn't they be able to tell you to be healthy? Anyway, so that's the kind of thing that you'd be looking for. I would rather go with rugged individualism and get to decide what I want to eat. If I want to smoke or drink or any of these other unhealthy things, I don't want the government stepping in and telling me I can't do things. One of the things that they talked about in the UK, because the UK obviously, they run their own healthcare system. They don't even pay someone else to do it. They run it, and they have instituted calorie caps on fast food restaurants to try to reduce national caloric intake. They also tax sugary beverages. So if you're a soda company, you're paying an extra tax. And we see some of the same things here. Berkeley has a soda tax. Chicago had a soda tax before they repealed it because they had too many protests. Philadelphia did that. But researchers have found that it hasn't really made much of a difference in sugar intake or in decreasing calories. Wasn't it our lovely Mr. Mike Bloomberg, who now got out of the race, that he wanted to make large sodas illegal, or he did in New York City? That's so stupid. It's like you can't go back and get a refill or buy 2 mediums. I mean, it's just ridiculous. When the government tries to start controlling your life, you can see the absurdities that will ensue. All right, so the single payers proposals that are out there. The biggest one that I'm going to talk about, because Bernie Sanders, like I said, is running for president, and so everyone's looking at his. But he and this, I don't even know how to pronounce this lady's name, Parmila Jayapal, in the House, introduced a bill in 2019. More than 12 senators and 100 representatives co-sponsored it. And so obviously this is a serious proposal. And the CBO, Congressional Budget Office, said that government spending would increase substantially and potentially lead to lower quality care for patients. That's another big question. Even if you still think, okay, yeah, I want the government to take it over so that everybody is covered and I don't ever have to worry about it again. I just know the government will cover it. Are you willing to give up the quality that you have now? Are you willing to have lower quality healthcare than you have now so that you know that everybody has it? Just start thinking along those lines. But this proposal by Sanders, and I'll just call her Jay, is soup to nuts coverage for everyone living in the United States, citizens and non-citizens alike. Their plan would cover hospital and physician care, chronic disease management, prescription drugs, medical devices, mental health and substance abuse treatment, laboratory and diagnostic services, long-term care, and even dental, vision, and hearing care. All free of charge, no deductible, no coinsurance. So everything, and of course that all sounds lovely. I mean, I wear glasses. I actually wear hearing aids. For those of you that don't know it, I have bad hearing. I pay for that out of pocket every year. But guess what? I go to Costco. The free market is great. They are much cheaper than other places. I shopped around. I found that Costco was really cheap. Anyway, Sanders envisions a modest copay of up to $200 for prescription drugs. Jay eliminates even that. So patients could, in theory, see doctors on demand with no referrals, pre-authorizations, or provider networks. Jay says patients will have complete freedom to choose the doctors, hospitals, and other providers they wish to see without worrying about whether a provider is in-network. So obviously she's trying to say this is going to be so much better than some of those terrible healthcare or insurance plans you've been on before. And Medicare for All would be more generous than the existing Medicare program. Nearly 1/3 of the beneficiaries of traditional Medicare rely on current or former employers to supplement their coverage. I don't think most people that are not on Medicare realize this. Medicare does not cover everything. 29% buy additional coverage on their own on top of Medicare's baseline benefit. 22% receive supplemental coverage from Medicaid. So Medicare is not doesn't pay for everything. Those who don't have supplemental coverage under the existing Medicare program face the potential for unlimited out-of-pocket costs, a cap on the number of days that they can spend in the hospital, and 20% coinsurance for outpatient care. So by making care free, Medicare for All would prompt unlimited demand from patients. So I want you to hear that again. It would prompt unlimited demand from patients. So if you're someone who wouldn't ordinarily go to the doctor if you knew it was going to cost you money on Medicare for All, heck yeah, why wouldn't you go for every little thing? Oh, I found a wart on my thumb. I've got to get in there. I've got a cough. I've got to get in there. People will start going for everything and anything. And this happens. One of the things that they do in England, because England covers everything, including prescriptions, is people are getting prescriptions for shampoo and body wash. I don't know how that's happening, but obviously they're getting that for free. This is how people will abuse a system when things are free and there's no patient responsibility at all. But there's a limited supply of doctors, hospitals, etc. So meeting the increase in demand would be impossible, which obviously means that you have to do what they're doing in Canada and England, and it's called rationing, and we'll get there. No other country in the world offers anything like what Sanders and Jay are proposing. Canada and the UK require some cost sharing. Out-of-pocket costs, usually high on things like prescription drugs, account for about 15% of national health expenditures in each country. The same goes for Denmark, Norway, and Finland, where out-of-pocket spending costs account for 13.7%, 14.6%, and 20.4% of national health spending, respectively. So, in other words, no other country, and somebody on Facebook told me the other day that they thought Sanders wasn't modeling his healthcare after Canada. It was after Denmark. Well, Denmark doesn't have free prescriptions either. So obviously, Sanders and Jay are modeling it after nobody. It's just a pie in the sky. We're going to make it happen. It's like they're magicians. We are going to wave our magic wands and make it happen. Sometimes I think when people hear that the government's doing something, it's like they envision this. There's just these blank checks that the government can write a check. And as long as the government writes a check, it's free. It's just provided. It comes from nowhere. All right, so this would end private insurance. Private insurance would be outlawed. The government would have a monopoly over the provision of health care, and doctors would be forbidden from accepting private payment for anything the government pays for. It nationalizes the U.S. healthcare system. This is in the bill. This is not me saying worst case scenario. This is what they're proposing. You could buy private insurance for things not covered, but those only include elective and cosmetic surgeries, because that's the only things that wouldn't be covered under this Medicare for all. It's almost impossible by definition to buy insurance for elective procedures. Insurance is designed to cover unexpected health costs. There's nothing unexpected about a nose job. Disruption. The 181 million Americans who get their health benefits through their jobs would be forced off of them, as well as the 52 million Americans who buy them on the individual market. The more than 20 million seniors with Medicare Advantage plans would be forced off of those. People on Medicaid would lose those as well. Only those, this is funny, only those enrolled in Veterans Health Administrations and the Indian Health Service would be excluded. Those people can keep their plan because those two plans are plagued by delays, poor quality care, and rampant malfeasance. So if you want to know how Medicare for All is going to run, maybe you should take a look at the Veterans the VHA plan and the Indian Health Service to see what we would all be in for. So most people who support Medicare for All think they'll be able to keep their private insurance. They are mistaken. And they want to do this transition almost overnight. They propose to make this transition in 5 years. Sanders envisions a 4-year transition. In year 1, anyone younger than 19 or older than 55 would be enrolled in Medicare. In years 2 and 3, anyone over 35 or under 45 would be eligible. By year 4, everyone in the country would have a universal Medicare card. So we would be fully socialized medicine by then. Jay hopes to accomplish a transition in just 2 years, which is funny because, as she points out in the book, when Obamacare rolled out, it took 3 years to build the healthcare.gov website. 3 years to build the thing, just to build the website. And then on the first day, 6 people were able to enroll. Remember all the problems they had? But this lady, Jayapal, wants to transition everybody in 2 years into a completely different system, not just building the website. All right, so they both propose to pay for their plan by ordering doctors, hospitals, and other healthcare providers to take massive pay cuts. There can be no problem there, right? All these doctors and nurses, they'll stick around for receiving 60 to 75% of what they were getting before, right? Also, in England, a lot of doctors have quit, and they keep quitting because they're constantly working overtime for no pay. Because of course they want to provide the health care, but they don't have, the money's not there. So they keep working and they get burned out and they get stressed. Something like 1 in 4 nurses talk about taking sick days regularly because of the stress. That's what they want here. All right, so the House bill would also require government to set a cap for national health spending. This would limit how much could be spent nationwide each year for benefits, professional education, administrative costs, capital projects, and public health activities. So obviously, what we would be looking at here is providing an unlimited supply with limited amount of money. So, what could be the problem? Obviously, there would be a huge price tag. Oh, but first they talk about the plan would impose price controls on pharmaceuticals. These price controls would hamper drug development. Yeah, right now, a lot of people are complaining about drug prices. And the problem is that some of these are really expensive because of all the R&D that goes on. You start capping all of the drug prices, guess what? No more R&D, no more new medication. Whatever's out there on the market now is it. Nothing new down the road. I don't know about you, but I don't want to halt R&D on medication or on anything else. But when you start socializing all the industrialized nations, that's what's going to happen. Who's going to do an R&D? The government's not going to pay for it. They can't even pay for the doctors. Enough doctors or nurses in Canada or in England, they're not going to do an R&D on, I heard that blindness is almost cured in some instances. I would like to see hearing cured. I don't want to wear hearing aids for the rest of my life. But that's going to be the case. We're going to stop right where we're at. We're not going to have any more advancements because there's not money for R&D under socialized medicine. All right, so it's estimated to cost between 32.6 and 57.8 trillion over the next decade. It would increase federal spending by more than 55%. We're talking huge numbers here, people. Even doubling individual and corporate federal income tax receipts. So even if they doubled your income tax right now and corporate federal income tax would be insufficient to cover the cost of Medicare for all. So also Medicare is beset by fraud. Something like in 2017, they made $52 billion in improper payments. You don't think that's going to happen in Medicare for all? Of course it is. Huge amounts of waste. So it's too expensive. It's wasteful. If you want to know how bad the healthcare system is in Canada, watch or listen to my last episode that I did on one man's experience in Canada. He was an American that lived under the healthcare system here, moved to Canada, and then dealt with it there. Let me just throw out a few things. Sometimes patients are waiting in hallways for hours and hours in the ER. One guy got stuck in a bathroom. That's where they parked him. There aren't enough doctors. There aren't enough nurses. In Canada, they don't even pay for prescription drugs. So they are even more funded than what we're talking about in the US, and they're still falling way below. The problem is you can't get in to see your general practitioner. Once you get in to see him in Canada or in England, if you want to go to a specialist, you're talking about 4 months to wait to see a specialist. So people are dying while they're waiting for specialists. Or if they do become acute, they go to the ER, and by then it's too late. They've waited too long. They're already on their way out. Or they get there, even they get to the ER and they're waiting. There are stories about ambulances in England where they are parked outside of the ER waiting because there's no place to put them in the ER. So they're in an ambulance waiting for up to an hour sometimes. All right, so there's lots of wait times. In 2018, 72% of wait times nationwide in England exceeded what physicians would deem reasonable. So we have huge wait times in Canada, huge wait times in England. And by the way, did you know that in both Canada and Great Britain, doctors went on strike when this was first proposed that they socialize medicine? They're not happy with it. None of them are happy with it. The doctors are getting low pay. They're leaving, like I mentioned, especially in England. So people are turning to private healthcare. And in Canada, you're not allowed to pay. So what they want to do here, you can't go out and get health insurance to pay for anything the government pays for, only what they don't cover. In Canada, they also don't cover dentists, eye care, or long-term care. So you can buy health insurance for those. And so they're paying high taxes, plus they're having to go out and buy health care for those extra things. But in America, we're not going to do that. We're going to cover it all. No problem, right? So other problems, procedures and appointments get canceled. People are turning to healthcare, private healthcare in Canada. They've actually been suing to pay for it. They've got people that want to pay. They can't. We'll see where that goes. So while Americans' healthcare cost, we are paying more for healthcare here in America than they are as a percentage of our budget. Our quality of healthcare is much, much higher. Just look at the people that come over. Mick Jagger that came over for his heart issues. Michael Bublé, who moved his family down to California when his son got cancer. All right, so, and that's not even counting having to wait in long lines to see someone. The other costs of rationing, like if you can't get to see a doctor and then you're out, so you can't go to work because you're not healthy, that costs tons of money. Oh, and then the other thing that's going on in England is that because they're rushing these people so much in the ER, they're causing deaths and other problems, and they're getting sued. So they're paying out these settlements and legal fees because of negligence. Lots and lots of problems with this. All right, so you're saying, okay, and I get it. Socialized medicine sucks. It's way too expensive. We would all lose our private insurance. We would all get stuck going wherever our government tells us to go for healthcare. We might not even get decent healthcare. It would suffer a lot. Our taxes would go way up. It's all bad, right? So what's the alternative? Well, there are a lot of alternatives. Okay, we live in America. I always hate that when people say, we're the only industrialized nation that doesn't have universal healthcare. We're America. We're not any other industrialized nation. Let's do what we do best. Let's use the free market, for crying out loud. So, first of all, we can provide quality, affordable health care for everybody. So she tackles the 27.5 million uninsured number that I talked about earlier. And this is what she says. Most Americans have health insurance, and it's easier to improve what already exists than to create a brand new healthcare system, from scratch. The United States is already at almost universal coverage. Only 28 million are uninsured. That's less than 10%. Shouldn't be hard to get them insured. And she says, according to the American Enterprise Institute, 2/3 of those that are uninsured are either eligible for publicly subsidized or employer-sponsored plans, but just haven't enrolled. Okay, so that's what I was thinking. Who are these people that are either working for a company that provides insurance, or there's Medicaid or Medicare that they're not on? So 2/3 of them just aren't enrolling. So first of all, we need to get them to enroll. So if we're that concerned about it, let's do what we need to do. Do we need an ad campaign? Do we need to send them letters? I don't know. But, people are out there. I mean, for a while, I just wasn't on anything. I didn't want to be on Medicaid. I didn't want to be on a government program. And I wasn't working for anyone full time. So I just went without. I went without in college as well. Why is that a problem? I mean, I'm taking my own chances in my own hands. Then Obamacare came along with a mandate. And I said, I guess I'm going on something. Anyway, so 2/3 of them, we get them onto something. Another 2 million are ineligible for employer coverage and for premium credits under Obamacare, but come from wealthy families. So these are people that can go out and buy it on the individual market. They just aren't. So there's no reason we shouldn't be covering them. That leaves only 2.5 million people, or less than 1% of the total population, who are in the country legally, because we're only covering legal people. We can dispute that if we want, but we're talking about legally. Had low incomes and did not have access to an insurance plan. It would be cheaper for the government to give each of these 2.5 million people $1 million than to implement Medicare for all. In other words, we can cover these 2.5 million. We don't need to create Medicare for all and socialize a fifth of the economy to cover 2.5 million people. All right, so now that we've talked about the numbers, here are some of the obstacles some of the things we can do. Get rid of Obamacare, get rid of mandates, regulations, and taxes. This will lower costs right away. Like I mentioned before, Obamacare made everything go way up. So let's get rid of that. Let's equalize tax treatment between employers and individuals. $1 of untaxed health benefits is worth more than one taxed dollar of wages. Employees end up consuming more care than if they had to use tax dollars to pay for it. Employer-sponsored plans insulate patients from the true cost of their care. They have to look at their pay stub to see how much of their paycheck goes to health care instead of having to write a check for it as they would with other forms of insurance. So in other words, let's take health insurance away from being an employer benefit and let's give it to the individuals to do. We can have our own tax-free money that we can save. I look at it this way. If employers stopped offering the benefits and just started giving us more money, we could then take that money and save it. In the second idea here, or the third idea, is to expand the use of HSAs. So let's take that money and stick them into HSAs, which are also going to be tax exempt. So this injects consumerism and price consciousness into the healthcare market. People are wiser stewards of their own money. HSAs right now are not available to everyone. They should be made available to everyone, not just to those with high deductible plans. People should be able to use their HSAs to buy insurance premiums, which they aren't currently allowed to do. So if we loosen the restrictions on what patients can contribute to the HSAs, we take the money that we're either getting from our employer or from our own company or whatever, put it into an HSA, and then we can go out and buy our own insurance on the individual market. And let's make that cheaper. Let's loosen and remove restrictions on health insurance. Get rid of the state and federal mandates on insurance. Let people buy the kind of plans they want to buy. Like for me, I'm 51. I don't need maternity. Okay, I'm at a place in my life where I don't want to buy a really fancy plan. Maybe I want a catastrophic plan and then I want to save HSA money to just go, for my annual doctor's visits. Like maybe I just want to go in for my annual well visit, or if I get a cold that's really bad or something, some reason. Maybe I just want an HSA that will cover those things that I do annually, mammograms, etc., and then have a a plan to cover me if I end up getting cancer or break bones or something like that. Right now, you can't really just buy whatever you want on the insurance market. But if we could get rid of state and federal mandates on insurance and let people buy the kinds of plans they want to buy, then guess what? Prices will go down. Let nurse practitioners and physicians' assistants do more than they do now. They're cheaper than doctors. Remove restrictions on retail clinics. There's little clinics when you go to the grocery store. You see them there. They can't do a whole lot right now. Let them do more. They're a lot cheaper than going to the ER. Wipe away restrictions on using Skype for appointments. Get rid of federal mandates that require doctors to keep electronic records. Push states to do tort reform so doctors will stop doing so much defensive medicine where you go in and they give you every test in the book because they don't want to get sued for not doing it. And then, okay, so those are a lot of huge things that you can do. Also, you might then say, well, what about these people with pre-existing conditions that they can't get covered? We can require insurance companies to cover anyone who maintains continuous coverage from year to year without raising premiums if they get sick. A continuous coverage requirement would incentivize young and healthy people to buy and hold insurance. So like say you're 25 and you get a super cheap plan. If you keep it and you never go off of it, it stays cheap. Whereas if you buy it when you're much older, then it's very expensive. So let these people go in, buy, and stay on. That way when they get they acquire something, then some illness, they're already covered. And this will ensure a steady flow of premiums into the insurance risk pool and prevent the unintended spike in costs that occurs when people only sign up for coverage when they get sick. For those who truly cannot secure affordable coverage because of pre-existing conditions or health status, Congress must provide robust funding for a state-based network of high-risk pools. Such pools segregate the sickest people from the rest of the population. So we take these people out of that population that's buying regular health insurance. This allows the insurers to keep premiums stable and affordable for the majority of the population. So take these people out, put them in these state pools, and fund them through the federal government. That's still a really small percentage of the people. Rein in entitlement spending. Instead of matching money to states for their Medicaid spending, send Medicaid money as block grants. That way they're not incentivized to spend money and they can do what they want for each state, whatever is best for each state. Raise Medicare age to 67. Did you know the life expectancy was 70 when this was first started? It's now way over 80. So we're not supposed to be covering people for 15 years. Just raising it 2 years would make a difference. Give seniors vouchers to shop for Medicare plans. Then they can use their own money, including from their HSAs, to supplement them. So these are just some ideas, and there's tons of them out there. But if we can get the government a lot more out of healthcare instead of putting it more into healthcare, we can lower premiums, lower costs, make it more affordable for everyone, and make our own decisions, get to decide who our doctor is going to be, what our plan is going to be. And we're not trying to, we're not allowing the government to come over, take over and become our nanny. Another problem, well, before I move on, again, this book is where I got most of my information, statistics, ideas. False premise, false promise, Sally Pipes. Another thing I want to end on is when you socialize, if you do decide to socialize medicine because you just think it's just another great plan. I have so many people that argue with me on Facebook that are either left or call themselves centrists that want something like this because it's just fair. Okay, let me just ask this. If we're going to decide that healthcare is a right, what's to prevent us from going further and saying food is not a right, housing is not a right? I mean, a job is not a right. It's a slippery slope. We're already a big government country. I don't think we need to be any bigger. Again, more government, less freedom. That's just the way it is. So I say, let's scrap the whole idea of socialized medicine, and they're trying to do it in Colorado and other states, which is terrible. But let's scrap those ideas and let's start looking at some of these free market plans. Rand Paul had a plan. There are several Republican senators that are advocating for this, okay? There's not a lack of ideas out there. What we need is the political will and the reality check that we don't want to live in a nanny state. We don't want long lines. We don't want to wait in emergency rooms. We don't want to wait 4 weeks to see a specialist. We don't want these things. And we don't need it. There's no reason. We have so many better options. let's scrap the idea of Medicare for all and start thinking about ways to use the free market and to maintain our freedoms. And that's me on Medicare for all. It's not all that. It's terrible. It's a terrible idea. All right, so I'm getting off my soapbox. Thank you for listening. Again, find me at AnnetteTalks.com, iTunes, Stitcher, Google Play, Spotify, YouTube, Facebook, etc., etc. Please follow me on Facebook, subscribe on YouTube, share this episode with your friends. Let's not get trapped into these socialist traps. Again, off my soapbox. Thanks for listening to Annette on Life, Liberty, and Happiness.